Hi guys, Dr. Luster here, and I wanted to take a quick second to talk to you about what is neurological switching. So this is a topic that we have covered a lot in your one-on-one appointments, but not necessarily had a full-on explanation. So I wanted to take a second to explain. So for those of you that have been with me and you know what I'm doing a little bit, so it's specifically referencing when we touch right here on your clavicle. So I will backpedal to that. So neurological switching is this idea of that your brain is not talking to the right side of your body. And what this means is that there is stuff going on in your brain that is somehow disconnecting the communication pathways or switching them. So the things that can do this can be really anything, like hitting yourself in the head because your skull bones are affected, or certain medications, or chemicals, or certain smells, or having a migraine headache. Really alcohol is a big one. So all sorts of things can cause neurological switching. And it's significant for specifically when we're doing the AK muscle tests like we've talked about in other videos. So what we do to negate some of that neurological switching is touch the acupuncture points here at the base of your clavicles. It is called K27. It is kind of the overall reset point for your system, and for whatever reason, it gives us a clear signal and temporarily negates neurological switching by drawing your brain's attention there. So that's one of the ways, but we can also, sometimes we'll give you RNA as a supplement and put it underneath your tongue. And as long as that is in your mouth, it is temporarily negating any of the medications that you took. So those things are very, very helpful when we're looking at neurological switching. Now, why would we look at neurological switching? So as we're doing some of these muscle tests, it might come up that you're complaining of pain in your right thigh, but as we're muscle testing, it's actually coming up that it's not lining up. Things aren't either a clear muscle test, like you're shaky, or not a hard yes or a hard no kind of thing, or if you touch the other side, that is where you get your yes. So then we have to go back through and find out what is possibly causing that neurological switching, and it usually either is a cranial fault, so a skull bone, or something along your rib cage. One of your ribs being out can usually affect those things. So then we would go fix those and come back and see, now is your test actually clear? So when we're talking specifically about neurological switching, the anatomy part of that, or the physiology part, whichever you prefer to use, is usually your right side of your brain talks to your left side of your body to get information, and your left side of your brain talks to your right side, with the exception of the face. But anyways, as you become neurologically switched, I might be getting information from where my right side of my brain is actually talking to my right side of my body, because it's confused as to where the line of the right side and the left side is, or it's just, there's always overlap. So it definitely can always talk to the right side, but for whatever reason, now that is the dominant primary information giving thing, and which tells you that there is something wrong in the pathway. Like, it should be talking to the left side. So where is the problem? What is causing the switch? A lot of the time, switching will also present in a lot of behavioral stuff. So you might experience a lot of extreme anxiety, or just like an inability to calm down. A lot of the times that results in switching. Now, which came first, the chicken or the egg? I don't know, but you might see it present as that, or you might see it present as like stumbling or shuffling into things, like that kind of thing, where you just don't seem to have a lot of coordination, whether it's with your words and you kind of jumble them up a lot, or with your overall demeanor, or actually with physical movement. So neurological switching is important because we want to get clear testing, so as we correct things, we're correcting the right side, basically. So I know that's kind of complicated. I know that it is not an easily graspable thing, but ultimately, when we are looking at that, and when we are adjusting you, we are taking those precautions by touching this K27, by adjusting your cranials, making sure that they're in place through the muscle testing, and also by giving you RNA to try and make sure that we are getting the right answers and really, really clear on it. This is something that a lot of doctors who do muscle testing will miss because they don't take the time to learn this concept, and this is a big AK concept. A lot of people really are truly neurologically switched. And it has to do most of the time with like medication. For myself personally, I usually get switched if I ever take Advil or, and I'm not sure why. Why specifically Advil? I don't know, but it consistently gives me cranial faults and switches my brain. So it really can depend. Alcohol also does it too, by the way, for me. But it really can depend. And as we go through it, like I said, we will eliminate those as a possibility so we make sure we get clear information. But I did want to take a second to explain a little bit of it because it can be very complicated. It is a very complicated concept. And even, as you can see, even this was a hard explanation to really put it into words. But yeah, it's just that concept of your brain is talking to the wrong side and we need to clear it up. I hope that helps, guys.